Over the next couple of minutes, we're going to be talking about how to treat anterior crossbite cases with Powerprox 6 Month Braces. Now, I like to follow a simple 1-2-3 method when correcting anterior crossbites. First thing we want to do is create mesial distal space for that blocked out crossbite tooth. We do this with a combination of Reprox and shape memory nickel titanium arch wires. We also use open coil spring to help give us that additional mesial distal space we need as quickly as possible. Once the space has been created, we remove the bite interference using normal composite buildups. And then we engage the tooth and crossbite with a slingshot. We don't like to use continuous nickel titanium arch wire here because that can cause unwanted rotations and also lingual direction on the adjacent teeth. So use the slingshot. It's a fantastic way to go. So again, first create mesial distal space with Reprox, shape memory nickel titanium, and open coil spring. Once space is obtained, we remove the bite interference with buildups. At that same visit, we also place a slingshot to engage that tooth and crossbite and shoot it through the hole. So here's just a clinical example. Again, we're creating mesial distal space with Reprox, nickel titanium arch wires, and open coil spring. Then we remove the bite interference with our buildups. If the patient does not have a deep bite, which is very common in these anterior crossbite cases, do not place the buildups until you are moving that tooth forward. They serve no purpose otherwise. Then you place your slingshot. At the same day you place your buildups, you're placing your slingshot to move that tooth forward. Now, slingshot and open coil spring are a 1-2 team. You always place open coil spring and slingshot at the same time. This is going to maintain the space that you've created and also prevent unwanted rotation of the adjacent teeth. Once that tooth is moved forward better into arch form, you go ahead and remove the slingshot and bracket the tooth. When we bracket it, we keep some torque tricks in mind. When we're just bringing that tooth forward with either a slingshot or even if you were using a nickel titanium arch wire, a round wire or a slingshot will tip the tooth, leaving the apex behind. This will give a non-uprighted look to the tooth, and it won't be as aesthetic as if we go ahead and try and upright the tooth. Uprighting the tooth is also called torquing. That's where we're trying to move that apex of that root in this situation labially to give a much more upright appearance to the tooth, much more aesthetic look to the tooth. Now, in order to achieve torque, you need to have a large rectangular wire completely filling the bracket slot. Now, that may or may not be something we want to do in Powerprox on all the teeth, but on our target tooth, especially those laterals that are in crossbite, you want to do this. We found the most predictable way to do this is to take a smaller bracket slot, an 018 bracket, and place it on the lateral incisor. Now, another trick is to turn it upside down. This will give additional pre-programmed labial root torque, labial root apice movement for more uprighting power. Now, what we do is you have to use a wire that will fill that slot more completely. So we like to use a 17 by 25 arch wire in these situations. Now, torquing teeth does take time, so you may not get full torque in these situations. But we try to get as much as we can on these anterior teeth because it will just look nicer. Now, here's a clinical example showing how we placed a slingshot on a lower canine. And the lower canine is the most difficult tooth to move in the entire jaw. Okay? So we went ahead and we made space for this lower canine with Reprox, nickel titanium, and open coil spring. Okay, in this case we actually used a lower incisor extraction as well. But anyway, make space for that tooth. Then we go ahead and engage that tooth with the slingshot. If doing this on an upper tooth, you would have to place your buildups to allow that incisal edge to clear the opposing arch. And look, in just one visit, that tooth, which is the hardest tooth in the head to move, that lower cannon, is in position. We can get a bracket to it, get our arch wire in, and finish the job. So just to summarize, when you are correcting anterior crossbites, you want to create mesial distal space first and foremost. Then you go ahead and remove the bite interference with your buildups, engage the tooth using a slingshot, and then when you're bracketing the tooth, particularly those upper lateral incisors, bracket that tooth utilizing torque tricks, namely an upside down 018 slot bracket, and work yourself up to a nice 17 by 25 arch wire. Using these tricks will get you the best result, the fastest result, and it will be very, very smooth and easy.